So a patient would come in for veneer procedure because they're not happy, number one, with how their teeth look. It can be something where they have an internal type of staining. It used to be there was something called tetracycline staining, which was when a mother would basically take tetracycline while they were pregnant, and then their child would get these dark gray or black lines on their teeth. Because we've learned more about what happens with antibiotics, we don't see that quite as often, but that's the type of case where you can do all the whitening in the world, you're not gonna see a change in your teeth just by doing whitening. So laminates or veneers would be a really good choice in those cases. Veneers or laminates can be replaced. Sometimes people come in and there's a crack in it. It's split down the side or it's broken off. And sometimes as an emergency procedure, we can remove that little place and place a composite or a tooth-colored filling material to basically patch it. The patch will last for a little while. It's not as aesthetically nice looking as having a new veneer or a laminate. When you have other laminates that are there, you want to match the tooth to your other teeth, and so the best thing to do is to remove the laminate and replace it. My belief with veneers or laminates is it always comes down to with my patients. And so I talk to my patients all the time about, before we start the procedure, how they feel about shades. Do they want something that's very white? Do they want something that matches them? I always prefer something that looks good. I want my patients to look natural. I don't want people to say, oh my gosh, those are fake teeth. And so anything that we can do ahead of time basically helps us build the case as we go. We take our preoperative photos, we basically wax up the case so that we know what the case will look like after, and we can show all that to our patient before we start, and then we know where we end up. We talk with our patient, we get a lot of input because it's a team thing. I can't do it without my patient, and my patient can't do it without me. Veneers can be made out of different types of materials, and we're basically talking about the type of how light is transmitted through the materials. There are some materials that look amazing. I mean, you would not be able to tell that they're not teeth, and there are other materials that are more monolithic, meaning it's basically they're more of a shade that basically stops the light. Those would be used in a tooth that's stained so badly that having the light transmit, you would show some of that dark shading through. So we want to do things that basically make the teeth look the best they can. And we talk with our lab, and that's why we have our whole planning process. So the lab can say, this is what we're concerned about, and we can talk with our patient and we come up with the best choices. Veneers can stain if they get decay underneath or if there's a loss of cement at the edge and they get underneath. But because we're the bonding material that's used to actually bond the veneer to the section of the tooth, very rarely do we get anything getting underneath there. As with any type of restoration, brushing, flossing, routine hygiene and exams. And even though we say that's simple, it's a very hard thing for some people to follow through on. I want people to have restorations and they don't need to be replaced for a long, long time. There's always been names in dentistry thrown around where there's holistic dentistry or there's natural dentistry or there's cosmetic dentistry. And I think a dentist should be doing all of those things anyway. And so I don't like to have a specific type of term that defines me, because I try to take in all of those different pieces. I look at my whole patient. What are their needs? What are their problems? And restorative type of work is the type of thing that they're going to live with all the time. And so it's very important because it can be the starting point, but it could also be the ending point of treatment that we do for other types of things.